All right, for this presentation, we're going to review Chapter 64 just somewhat briefly, and just kind of review the assessment of the endocrine system. So this is just a good picture of all the endocrine glands that are in the endocrine system, where they are located in the body. It's very important just to kind of get a visual of this. All the endocrine glands secrete certain hormones, and these hormones are natural chemicals that exert their effects on specific tissues. These are known as target tissues. It's amazing once you start to read all these, exactly the effects that these endocrine glands have on all the other organs in the body. And without these hormones, what can happen with the other areas, the target tissues, the deficiencies and disorders that can occur just by simply not having these hormones to activate the tissues to work like they should. So the major endocrine glands consist of the hypothalamus, the pituitary gland, and you have the anterior and posterior pituitary gland, the adrenal glands that sit on top of the kidneys. You have the thyroid gland, which of course is located up around the neck. The islet cells of the pancreas, the parathyroid glands, and the gonads. All these hormones that are secreted from the endocrine system, they all work to maintain homeostasis in the body. And they work along with the central nervous system as well. So pretty important function that the endocrine system has in order to maintain normal function of all the organs. So the typical disorders occur when there is an excess of a specific hormone, if there's a deficiency of the specific hormone, or the receptor has a defect. So this is where the hormones are received and it does its action. Maybe there's a defect there. So lots of different ways disorders can occur. We're going to talk about some of those disorders in the following chapters. So again, here's a list of the endocrine glands. If you look on page 1359, table 64.1, it talks about the hormones that are secreted from each one of these. It's important to kind of get familiar with that, to know where each hormone comes from, and then begin to familiarize yourself with the effects that these hormones have on the rest of the body. The hypothalamus sits up below the thalamus and just above the pituitary gland. If you look at the hormones that are secreted from the hypothalamus, it's typically hormone releasing hormones. So basically what's secreted from the hypothalamus actually goes to another endocrine gland. A lot of them go to the pituitary gland and affect the release of hormones from the pituitary gland. So the important thing to understand about this, if there's a hypothalamus disorder, it could actually create disorders throughout the body because it's not releasing those hormones that cause the pituitary gland to make the hormones that it releases. So sometimes if there's a deficiency in maybe the thyroid hormone, it's not because there's a pituitary problem, it's because there's a hypothalamus problem. So it's important to know that these two can affect each other. The adrenal glands, like we said, sit on top of the kidneys. And the adrenal cortex secretes the mineralocorticoids and the corticosteroids. These are all very essential to life. Deficiencies of these is where you're going to see Cushing's and Addison's disease, and we'll talk about that more specifically. And that's why it's important for you to understand what these mineralocorticoids and corticosteroids do. The corticosteroids have a lot to do with the metabolism of the body, metabolism of carbohydrates, the body's use of glucose, the body's response to stress, and immune function. So if there's a deficiency, you can see how that could cause a problem. Also, the adrenal medulla secretes catecholamines, which is your norepinephrine and epinephrine, which you've heard of. These are those hormones that affect your flight or fight response. So they have a significant effect on the sympathetic nervous system. And there's a really important table on 1363. It's table 64.4 that talks about the catecholamine receptors. These are really important to really start getting familiar with these beta receptors, because a lot of drugs that we are going to be talking about throughout the rest of this course will speak to those beta receptors for instance, beta blockers. So go ahead and look at that table and try to begin to understand these beta receptors that respond to norepinephrine or epinephrine, because a lot of the drugs talk about blocking those receptors. So you can imagine if you block those receptors, you're blocking the effect of epinephrine on these receptors. So, and just kind of have an understanding of what those do. And also make sure you have an understanding of the sympathetic nervous system and how it works in response to epinephrine and norepinephrine. So looking at the thyroid gland is in the area of the neck and the cricoid area. Thyroid hormones control metabolism, it's very, very important that you understand that it controls the calcium and phos balance as well. T3, T4, and calcitonin are hormones that are secreted by the thyroid gland. Calcitonin we've talked about. Calcitonin is that hormone that actually causes a decrease in the bone resorption, which means it causes a decrease in the breakdown of bone. It decreases the amount of serum calcium levels. We will talk about this a lot more specifically when we talk about hypothyroidism and hypothyroidism. Just make sure you take a look at the background on what the thyroid gland is, and that will definitely help you understand hyperthyroidism and hypothyroidism better. A couple of things to note is for the thyroid gland to function and to produce thyroid hormones, you do need dietary intake of iodine and protein. So an iodine deficiency could lead to a thyroid problem. So make sure you read over all the different things that can affect the thyroid gland. It's a metabolic thing for the thyroid, and it can really affect the patient as far as a deficiency or a hyperthyroidism. Also, make sure you review assessing a patient for an enlarged thyroid. It's in the interior of the neck near the cricoid. It does have a rich blood supply. So typically assessing a patient for an enlarged thyroid is pretty important. The incidence of thyroid cancer is getting higher these days, so it's important that you have an understanding of how to assess a patient for an enlarged thyroid. Normally the thyroid tissue, thyroid cartilage and cricoid cartilage move upward when the patient swallows. No swelling, enlargement, or lumps are normally seen in the thyroid tissue. So a good way to observe to see if you see any kind of a deviated trachea or an enlargement of the thyroid is to ask them to kind of hold their head up and swallow, to have them have a drink of water. There's other few ways you can kind of assess the patient from the back for any thyroid swelling. Typically, you should not see any swelling. Most thyroid swellings are usually can be seen easily, but no swelling, enlargement, or lumps are normally seen in the thyroid tissue. Okay, this is just a list of the different things to go through in an assessment to determine whether a patient may be at risk for having an endocrine disorder. And it's just important to remember the patient with endocrine disease may exhibit significant skin changes, which can include dryness, oiliness, petechiae, bruising, depending on their problem. Patients with Cushing's will have purple striae over the abdomen. Addison's disease can cause significant skin pigmentation, so it has effects on lots of different parts of the body, so it's important to be able to be aware of this and their physical appearance to trigger signs and symptoms of endocrine disease. And we'll talk about those a little bit more specifically when we get to those specific disorders. But I just wanted to point out that the skin can, a lot of times with these endocrine disorders, be one of your first clues. Energy level is an important assessment, especially if you're talking about the thyroid gland. Like how long have they had, if they have fatigue, how long have they had it? Is it a daily occurrence? Is it associated with any kind of activity? Do they have insomnia? Have they ever had any sleep apnea? Questions like, does the fatigue interfere with any activities of daily living? Also, heart palpitations. Somebody that complains of heart palpitations could indicate a thyroid problem or another endocrine problem. Insomnia, weight changes. Those can be big indicators of an endocrine problem, so it's important to, if they talk of that to kind of investigate that further. Family history, any kind of about the medical status of family members can help the healthcare provider determine a possible genetic or hereditary factor that may play a role in their disease. These are some of the physical assessments that occur with an endocrine problem. What I want you to do is become familiar with these terms. Make sure you define them. Prominent forehead is pretty self-explanatory, so is the round or puffy face. Those are typically related to an adrenal problem. Dull or flat expression, I think you're pretty familiar with that. Exophthalmos has to do with the eyes that are protruding. Vitiligo, striae, and hirsutism, that is excessive hair growth or hirsutism. So make sure you become familiar, because these are common physical assessments that you might see in a patient with an endocrine disorder. Of course, the endocrine system can have laboratory tests that can help us pinpoint exactly where the situation is coming from. And we'll talk about these more specific to each endocrine problem. A lot of it has to do with the levels of hormones in their body. Of course, the thyroid stimulating hormone that comes from one of the endocrine glands is something that would indicate whether there's a thyroid problem. We can check for cortisol levels if there's an adrenal level. So we'll look at this very specifically for each disorder. The important thing to do is make sure you understand how to accurately obtain the samples if you're the one getting the samples to do the test on. There are urine tests that can help us as well, that can test hormone levels if there's protein in the urine, if there's glucose in the urine, that can tell us, exactly what's going on with the patient. Sometimes the thyroid imaging, maybe a CAT scan, can tell us if there's an enlarged thyroid. If there's a tumor on the adrenals, that's what we would use imaging tests for. And again, it would be specific to which area we think there's a disorder that we would decide which test to do. This concludes this section. Just make sure you review Chapter 64 before you move on. I think it's going to give you a good background in order to understand the disorders. And this concludes Part 1. Have a great day.